We're on
The Doc
for
Talks.
The Doc Talks. I know you guys missed us last week. We missed you very much. But we're here again, and we're here to give you some knowledge on
Scoliosis.
scoliosis. A little bit of scoliosis.
We've done too many of these because we're that in sync.
Yeah,
we're
that's
that
pretty good.
Although we didn't match this time, though.
Yeah.
But that's all right.
Yeah, that's actually complete opposites this time. So
It is, yeah.
that is what it is.
We'll get there.
So we got scoliosis on the docket today. We're going to talk a little bit about. We'll talk about when to treat, what it is, what it isn't, and maybe some moves that can give you some relief or some routine things that you can do to maintain what you got.
Mm-hmm. Absolutely.
Cool. So what is it? What is scoliosis?
Scoliosis is a curvature of the spine that is sideways. It's normal to have curves within your spine. That is a normal finding. You should have curves that are more front and back. So it's normal to have a little bit of an arch in your lower back. It's okay to be rounded a little bit in your upper back. All of that, yes, actually, thank you,
Boom.
is a normal finding. So here, someone who didn't do their exercises that we prescribed, and like this would be the example of a normal spine. You can see that there's this if we're using the front side as a reference, we have a convexity curve here. We have concavity here, so it's a little bit more rounded, and then we have recurring curves up top. So that's normal. Now, a scoliosis is when we have a side-to-side difference in the spine. This person's very stiff.
Very stiff.
But yeah, it would be a side-to-side difference and sometimes some degree of rotation as well. So a lot of times you'll see people where it's kind of like, I can't do it obviously, but it's kind of like that position, but you're looking at it from a spine structural perspective. And that's what scoliosis is.
And we always, I guess I shouldn't say we always see, but we tend to see a lot of rib cage changes though too. So rib cages will tend to kind of flare out, and some will be kind of in different positions. If you look down and you see one side that's kind of up and one side that's down, that's typical because it correlates. The ribs attach all the way to the back portion of our spine, so right through our thoracic spine, ribs go around and they attach to the front. So if this in the back has a little bit of a curve, you can imagine that the ribs kind of have to follow that same type of structural change.
Yeah, and actually this is a good point to time to test. Like one of the tests that is classic to see if someone has a scoliosis is if you have someone bend forward to touch their toes. A lot of times you will see one backside of the rib cage flare up higher than the other. It's most commonly on the right, although some people have left-sided ones.
And that's typically like a neurologic case in my experience, or the education is there's been a neurologic compromise that kind of causes it to go the opposite way of the normal side. So if you see it on that side, might be something you'd examine.
Yeah, absolutely. And sometimes there's people who have doubles, where they'll have a hump like lower in the lumbar spine, and then they'll have an opposing hump up in the thoracic spine or in the upper back region. So there's a lot of different types of scoliosis curves out there. But I want to tell you about the most common one, and that's the scoliosis curve you get from being a normal human being.
Normal, big normal curves.
Everyone has a slight, mild scoliosis. There were a couple studies done in 06, 07 in the Spine Journal, a prestigious journal in our field, where they looked at people asymptomatic, no crazy amount of scoliosis, and they measured the various curves and contours of the spine. And all of those people had a slight rightward rotation about the spine. And there was another study too around the same time frame that also measured a slight side bend of the spine to the right. The reason why you have this has to do with the internal organ attachments, because you got a heart on one side, a liver on the other, and they posited that because of that inherent asymmetry that we have, it creates a scoliosis in the spine. Interestingly enough, here's how they checked to see if that was the case. They found people who have a condition called situs inversus totalis, which is where the organs are flip-flops. So you get your heart on the right, liver on the left. Guess what, folks? it was the exact opposite. It was the exact opposite. So they had a leftward
Left turns. Huh.
turns. So if someone diagnoses you with scoliosis and they don't give you specific angles that we'll talk about later, realize that that is a normal finding. It becomes problematic when it's beyond what we would consider a normal finding.
Yeah, and we spoke about it just right before we went live, but fear mongering and these diagnoses without context gets a lot of patients in a lot of bad situations. They feel like they're frail or broke or they're not normal. I was given a diagnosis when I was in college. I went to see a chiropractor, and he gave me a diagnosis of scoliosis, and I needed this massive treatment plan that was thousands of dollars to correct a scoliosis. Didn't obviously work with him. I contacted some other people, and they said probably not the best person to work with. This is before I knew anything about anything. So I obviously went somewhere else, and I turned out okay. I don't have like this massive scoliosis that changed or that I needed to get treated by any means. I probably did have a scoliosis, just like you said. Maybe you did find that slight asymmetry along my spine, but at the same time, it wasn't this thing that I needed a massive correction for because it was probably normal. But there are people that fearmonger with some of those findings because you can see it on a film or an X-ray. It's very visual and objective. You can see, oh, well, it's not 100% correct. There's these like little changes, and they'll point it out, and they'll say, there's certain things that aren't the same from right to left. Now that doesn't, if you don't know anything about your body and healthcare, that could be like, whoa, I'm starting to look like I'm, Frankenstein, have all these weird parts kind of turned and spun and stuff like that. So having context, like Dr. Couple said, is very important for any type of diagnosis where it's objective and you can see it on a film.
Yeah, and another thing to piggyback on the film side is, depending on what position you're measuring in too, that can influence the curves and the position of your spine, hips, many things, and that's constantly changing and adaptable. What we're looking for with someone who's got a legitimate structural scoliosis that might need a deeper treatment is specific angles that need to be measured, and we'll go into a little bit about what that is, and if there's symptoms that are supporting, we need to do something. Like in your case, did you have?
No, I mean, I was a football player. I had a rough couple weeks of football, and
Isn't that like the whole sport to have
I
had a rough.
I was playing football, so yes, it's rough. But that was the case. It was I had some tweaks and stuff on my back, and it wasn't necessarily like this gradual pain that kind of started coming on, and I would say that would be a little bit more representative of something that would be maybe needing to get looked at if it was an advancement of a scoliotic curve, and we'll talk about that again when we talk about the angles more specifically. But no, it was taking a couple of hits, regular wear and tear type things, and I went in and it kind of blew up to more than what it should have been in terms of the treatment plan. And sometimes that the ethics need to be checked there. So we've talked about it in prior doc talks, how to find your doctor that's going to make you feel the best, or how to kind of have checks and balances for that. Go ahead and take a look at that, because we've talked about fear mongering, we've talked about treatment plans, we've talked about all that stuff before.
Yeah. Absolutely. Now, we've been hinting about how do you measure this curve. Well, you need to have a professional do it. You can't just stick some stuff on you in the clinic to do that. You need imaging to do the curve. The angle that we're talking about is the Cobb angle. Basically, what that is you take the top part of one part of the spine, the bottom part, and then you measure the points between those, and it forms an angle. Generally, if you have an angle, a Cobb angle that's like greater than 15 degrees, so again, like that's less than 15, like that's a significant difference between that in terms of the angle, then it may be indicated that there should be some type of treatment. It's especially true if you measure it at one point and then you measure it at a later point in time and it's progressing at
Yeah.
a fast degree. And that could be as little as 5-degree changes.
Yeah.
This could be a situation where we want to keep that in check, because if at some point the curve gets bad enough, and that doesn't mean that your slight scoliosis is bad enough, it's probably going to be individualized. But in curves that are 35 all the way up to 50 plus degrees, that can potentially negatively compromise lung function. And that's when we start to think like, this is something that definitely needs to be kept in check, but then also too, it could be potentially serious if you don't take care of it.
Yeah. Yeah, and I think a lot of times we see that more in probably an adolescent. We see an advancement of curves. If we are going through like bone maturation, or our bones are starting to mature and become what it's going to look like when we're an adult, during that process, if it keeps on advancing these curves and we kind of keep on getting closer to that angle that is maybe a little bit more risky for lung issues, we need to make sure that we're on top of that stuff. So you can definitely like work on certain things during that maturation time, or during a time that you think that where you're trying to not let that stuff continue. So we'll talk about the movements and potential stretching variations and stuff that you can work on during that stuff. But
I'm thinking of your your treatment that we discussed off camera. So if you have a son or a daughter who needs some help with bone maturation, Kyle's got some interesting thoughts on that.
which one?
That where you're hanging and not moving in one
Oh
position to
gosh,
keep your spine
yes,
straight.
yeah. So the only way that we're going to really get like true 100% symmetrical spine from one to the other, we talked about like you're going to have to be kind of isolated for a very long period of time, because every time that we start to do something, it's usually on one side of the body, or we throw, or we play a sport, or we sleep on one side, and our body starts to kind of change to those things. So
we're rotational creatures. So.
Yeah, we're inherently going to have asymmetries in our spine. So again, we're just looking at how much of that there is. So the diagnosis of scoliosis is could probably be given out to anyone, like we've said, but we just got to make sure that those curves are contained and measured, and you know what to do if they start getting out of control. So treatments for some of these types of conditions, we can talk about there's bracing, rehab, surgery, and then when all of those things kind of come into play. So with bracing, you can talk about bracing.
Yeah, so with bracing, there's a lot of different braces that are out there. So consult with someone who specializes in those. But generally, if you're someone who's got that Cobb angle that is either between like 20 to 40 degree curve, which is pretty significant, or first diagnosis is about 30, and then when they do remeasures, it's progressing at a rate of 5 degrees or more, that's probably an indication that we should utilize some type of brace to mitigate the amount of change in the curve. Rarely do I think bracing in isolation works, but it can be an essential piece to kind of create that longer duration stretch on certain tissues, so the spine forms differently. So that would really be the long and the short of bracing. There's, like I said, a lot of different ones.
Yeah,
you don't have to wear it all the time, but
yeah, there's firm braces, there's soft braces, there's things that can almost like kind of remind you, and then there's things that can kind of hold you in place. So those definitely need to be considered. I lost where I was going to go with the bracing portion of it, but so with again going back to like an adolescent, I think most of the time we'll see braces work most effectively in an adolescent compared to someone that has already had they've gone through bone maturation. So you see someone that is 40 years old and they're trying to all of a sudden correct a scoliosis. It probably doesn't really work that well to have this structural brace. Now maybe they might need a supportive brace, a softer brace that's going to just kind of hold and hug, as opposed to try to push and maintain a position. Those are the hard casts. Those are something that in an adolescent population that might work a little bit better.
Yeah, absolutely. Especially because with kids, they get to take advantage of puberty in the sense that they're a little bit more
Yeah.
adaptable in terms of what you can and cannot change. The bone structure hasn't fully formed, and then once it does start to form and you have this brace on, you can reduce the degree of curvature. I mean, it's the same thing that you might see at your local dentist. If you have a dentist who gives your child the key to turn and expand that, well, the reason why they do a treatment like that is because the bone up there is much more malleable. So same thing with the braces here. The bones are malleable, so let's take advantage of that, use bracing to guide the spine to grow in the direction that we want it.
Yeah. So looking at it, so we've looked at bracing a little bit. If you have any questions on whether a hard, soft brace is something that you might be looking for, we're always here to answer questions. And then looking at rehab next, so right and left curvatures and trying to work on correcting or getting as close to correcting as possible, because again, we're not going to take scoliosis completely away. We're just going to manage it and maintain something in terms of a curve. When we look at the curvature, if it is, if my spine is kind of curved up to the right side of my body, getting all of the stuff on the left side of my body to open and expand, and maybe getting into some sort of rotation that gets us out of that one stagnant position. Movements that help that will make you feel better, but those tissues get circulation better. They open up some of those stagnant tissues. So when we look at moves for rehab, we have to first establish which way the curvature is going to go, which way the rotation is going to go, and then see what the opposite movement is for those findings. So again, right-sided curvature, if I'm up like this, then I might look to reach and go up over the top and open up the left side of my body. My rib cage opens up, and my spine angles open up on that side. So things that re-engage that, if you have a weight on this side that is actively pulling into that position, that's another variation that we can kind of use. But right and left curvature, establish which way and direction you need to go, and then we need to start creating movements that are going to go in the opposite direction.
Yep. And oftentimes, because of the ribcage involvement in scoliosis, you can also, broken record, mobilize things with breathing. So if we take the same move that Dr. Booth just did, so if Kyle go ahead and reach down, and then he reaches up to really get this to expand and stretch. If Kyle drops his lower rib cage down, I want him to take a full breath here in, exhale, keep going, keep going, keep going, keep going, keep going. Keeps tension in the abs slightly. Go ahead and breathe in, and he's going to feel a nice big expansion on that side of the rib cage. So then you can use airflow as well as tension in the tissues to create a stretch in the spine.
Yeah, so it's like stretching from the inside out, right?
Exactly.
I know you've used that before with patients, but I'm just going to use it for this context, because there's a movement that creates stretch, and then if we add pressure from the inside out, now we're just expanding that even more, because it's like a balloon filling up within your rib cage, and it kind of keeps on separating some of those tissues out. So that doesn't necessarily have to be loaded. If there's things that you can do that don't require weights, you can do probably one a lot more often, and you don't have to feel threatened with any weights. But I think every time that you actually load those into a little bit of with some weight, you might get a little bit more strength to kind of maintain those positions. So it's often. But then you can also load it to make it more strong. So often meaning you can do these stretches without having to set up equipment and do all that kind of stuff. But if we load it up too, then you start building some resilience and some tissue strength with that.
Mm-hmm. Yeah, absolutely. Now, if all else fails, surgery is a potential indication for this. Usually this is for very severe curves, so this would be greater than 50 degree with that Cobb angle. If there's continual progression of the curve despite bracing, despite rehab, sometimes the surgery is indicated, especially if there's lung compromise, but it is very much a last resort. The common surgery is to get rods put in the spine. They're called Harrington rods. And basically it fuses whatever parts of the spine are are presenting with the scoliotic curve. So you do lose motion there. Now, if you had that surgery or you think, I need that surgery, it's not a death sentence by any means, because a lot of times they do not fuse the entire spine. And even if they do, there's still a lot of areas on your body that can move. So your focus is getting movement in the areas that you do have access to, so you can distribute blood flow evenly throughout the body, move in the way you want to, and feel better.
Yeah, Harrington rods, they're tough, but like you said, I've treated multiple patients with it, and they're very active. They're hikers. They still do stuff. So they've maximized their hips. They've maximized their shoulders. They've maximized if they don't have neck compromise with it. They've maximized a lot of different areas of their body, and they're still very functional. So the curvature that is like pathological or risky, that does have to go through that. Make sure that, one, it's a sound diagnosis and it's not something that you're going to regret later on. You really do need that surgical intervention. But two, don't think of it as something that's going to be, you're going to be sitting in a couch for the rest of your life, because it's definitely, you have a decision to make there. It's you can keep on making progress.
For sure. Yeah, I mean, anytime, I think it's a good rule of thumb, if surgery is indicated and it's the first time you're hearing this, it's never a bad thing to get a second opinion. And that second opinion may be you still need the surgery, but at least you have two eyes. Just because, I mean, anytime you go under the knife, there's lots of risks involved with that. So don't hesitate to do that.
Yeah. Do you have any common moves that you like? I mean, not to put you on the spot, but do you have any common moves that you like for
scoliosis?
Yeah.
It depends on where the curve is, and it also depends on what the restrictions are. But like the move that you just did, the reach down, reach up is a really good move. Another move that I like, because everyone wants your favorite segment of the show. Let's
burn them up.
Let's make Kyle burn. I want you to lie on your left side, Kyle.
Lie on my left side. Facing this way?
Yes, face the camera.
I love facing the camera.
Out a little bit and tip you down. Hi. Thank you. Okay, so this one's like a really good lengthening move for one side. So if you're someone who's got a right curve, so meaning you're side bent to the right, well, this move, folks, is dynamite. So what you're going to do is have one leg on a chair of some sort. You want to do a hip tuck. And then what Kyle's going to do is he's going to reach his leg long, so he gets a little bit of glute on that top leg. You feel that?
Mm-hmm.
Cool. So that's how I'm going to lengthen from the bottom, but now I got to get that lengthening action from the top. So with that, my main man is going to reach. That's basically the same position that you did. Let your head chill like Bob Dylan. And he's going to do the same breaths. Go ahead and breathe in nice and easy. I want you to let out a nice exhale. Go ahead and reach as far as you possibly can. Keep a little bit of tension in the abs. There you go. But I don't want you flaunting the six-pack for IG. I get it, but go ahead and breathe in. Get the exhale, and you want to keep whatever tension you got from the exhale going on the inhale. And that should really get a nice big opening stretch there. And that's someone with a right curve.
Cool.
Now, if you're someone who's got a left one, like a left rib hub, interestingly enough.
And just so for IG, if we're talking about a right curve, we're talking about
side bent to the right.
Side bent to the right.
Yep.
Cool.
Yep. And a lot of times you would have a rightward rib hump with that. Now, if you're someone who has a leftward rib hump, you could most certainly do this on the other side. But a lot of times, interestingly enough, I will actually rotate that person to the left with a different move. There's a wall squat variation that I really like, because a lot of times those folks will have limitations in left rotation, but it's usually in the lower hips. So we're gonna get them to be able to rotate to the left side, and then slowly we'll teach them to rotate to the right. So it's like an untwisting action. So what Dr. Booth is going to do is he's going to be up against the wall. That far away. I want you to do a tuck. You're going to take your hand, and I want you to breathe in nice and easy. You're going to exhale. You're going to reach as far as you can and allow your chest to rotate to the left. Boom, but your back stays on the wall. Look straight ahead. Cool. Go ahead and breathe in again. Reach, 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 reach. Look ahead. So you'll feel a lot of quads with this, abs, probably a nice stretch right back here. Now, once you got that, you got the left abs going, go ahead and reach with your left arm instead, but I want you to keep your left low back on the wall. So I'm rotating the whole spine left, and then I want to just try to keep the upper spine going to the right. Look up, look up, look up, look up. Now, obviously, you'll need to consult to see what kind of curve you got, but that's my one-two punch for some scoliosis action.
That's a good one. One that I've worked with patients in the past, and I think it's pretty easy if it's in the upper back. If you have say my curve is like this, and I want to create side bend to the opposite side. Do you have slide pads in here?
Slide pads?
Do you have a slide pad in there or no?
Oh, like a valve slide?
Yeah,
no,
that's okay. So imagine that I had a plastic plate or something that's really easily slid. Oh, perfect. Boom. We got some. So I get one here, and then I'm gonna load myself a little bit. So I'm gonna put my weight into my hands, and then from here I'm gonna reach up and create a big circle. And I'm side bending with this side. I'm kind of using my shoulder to get depressed or shortened down towards my hip. But a big breath in, exhale, and reach, hold, and then take another big deep breath so that I'm expanding again on the rib cage side. So if I can get as much upper back movement as I can. So if I was on the ground, I would be doing this. I'd be reaching and trying to open up the right side of my rib cage with some breath at the same time. But now I'm putting a little bit of load into my hands. I have to stabilize that a little bit. That's another good one for opening up a curvature that is throwing my upper body to the right side. So.
And then if you got the flip-flop of that, where you just do the
flip-flop is obviously the other side. It's a little bit more simple for the upper curve. If it's right, you're going to the opposite side, and it's left, going the opposite side.
Yeah. But I mean, the overwhelming majority is rightward.
Yep.
Curve, so it seems.
Yep.
Cool.
So again, if you guys have any questions, we got the number here, 702-558-2151, or you can reach out to us at elevatesph.com. It says C on there because this is a little bit of an older design for us, but elevatesph.com, and follow up with an email, any of our contact us information on there, and we will get back to you. If you have any questions, shoot them on Instagram too, and we'll see if we can get those answered too.
Absolutely. And if you're thinking, I have scoliosis, I've been diagnosed, I haven't tried the conservative route, what can I do? When you do give us a call, you can talk to myself, Dr. Booth, or Dr. Wood, one of our other doctors, free of charge. We do free discovery sessions. Yeah. Come in, check us out. We'll see if we can help you, and if we can't, we will find people who will.
See you guys. Have a good weekend.
Adios.